Let's talk about atrial fibrillation. Atrial fibrillation is a common cardiac arrhythmia characterized by rapid, irregular, and disorganized electrical activity in the atria, leading to ineffective atrial contractions and an irregularly irregular ventricular response. Causes or risk factors include: cardiac causes include hypertension, most common; coronary artery disease, CAD, heart failure; valvular heart disease, especially mitral stenosis; cardiomyopathy, pericarditis; congenital heart disease. Non-cardiac causes include hyperthyroidism, pulmonary embolism, chronic lung disease, COPD, alcohol intoxication, holiday heart syndrome, electrolyte imbalances, EEG, hypokalemia, hypomagnesemia, post-cardiac surgery, stress, infection, sepsis. Then the pathophysiology. Multiple ectopic foci in the atria fire rapidly and chaotically, 350,600 impulses per minute. This causes loss of coordinated atrial contraction. Atrial kick is lost. The atrioventricular node filters some impulses, resulting in an irregularly irregular ventricular rate. Ineffective atrial contraction leads to blood stasis, especially in the left atrial appendage, increasing the risk of thrombus formation and embolic stroke. Types of atrial fibrillation: paroxysmal, episodes that start suddenly and stop spontaneously within 7 days; persistent, lasts more than 7 days and requires intervention to terminate; permanent, continuous atrial fibrillation, where attempts to restore sinus rhythm have failed or not been attempted. Lone atrial fibrillation occurs in patients without underlying heart disease. Clinical manifestations include palpitations, irregular, rapid heartbeat, fatigue and weakness, dizziness or lightheadedness, shortness of breath, chest discomfort or pain. Sometimes asymptomatic and detected incidentally. Signs of heart failure if ventricular rate is uncontrolled. Diagnostic investigations include 12-lead electrocardiogram, no distinct P waves, irregularly irregular RR intervals, fibrillatory F waves visible in some leads, narrow QRS complex, unless bundle branch block, Holter monitor to detect intermittent or paroxysmal atrial fibrillation, echocardiogram to assess atrial size, valvular disease, and cardiac function. Blood tests include thyroid function tests, electrolytes, and complete blood count. Electrocardiogram characteristics include absent P waves, irregularly irregular rhythm, no pattern to RR intervals. Fibrillatory waves, F waves, may be seen, especially in leads V1, 2, 3, and a ventricular fibrillation. QRS complexes are usually normal and narrow unless there is a conduction delay. Complications includes stroke due to thrombus,